We told you recently about a CNC textbook that looks strictly at First Nations health. It was published when the professor realized there wasn't much information on the issue. The determinants of health for First Nations often vary and have to be taken in historical context as part of a better delivery model.
What started as a request to teach at the College of New Caledonia led to the creation of a new textbook by Dr. Vasiliki Douglas, looking at healthcare delivery within the Aboriginal population. But the book also delves into some of the cultural differences.
Aboriginal people live their lives both on reserve, off reserve. And without that understanding, I think we would be very, very poorly equipped to come to solutions with them to address the healthcare needs that they have.
Healthcare delivery within the Aboriginal population is exactly what Murray Krause does every day at the Central Interior Native Health Clinic. He applauds the book, saying the history of First Nations is critical in delivery.
The need for healthcare providers to become really informed about the historical influences and things that have contributed to poor health in the Aboriginal community. And so to that end, the Ministry of Health created the Indigenous Cultural Competency Training, which it is their hope that every healthcare provider in the province would take that 8-hour online training.
There have been efforts in recent history to strive for more cultural safety in healthcare delivery for First Nations, especially within areas like Northern Health.
But I think one of the things that we've learned right from the advent or the beginning of this was the fact that Aboriginal people should be involved in the design of programs if they're really truly going to meet their needs. Because who better than the consumer to have a conversation about what would work and what might not work.
Krause calls it the work with us, not to us model. Dr. Douglas says any kind of delivery model must include an historical context.
Aboriginal peoples are the first peoples here. They've had a number of events, political, social, historical, which has affected their experience in Canada, and we see the outcomes in terms of health disparities over time, and they haven't been resolved.
Dr. Douglas says research in the field of Aboriginal health is rapidly growing, but there is a significant lack of materials to pass on to students. Cheryl Jan, CKPG News.